name is April, and today I will be demonstrating how to insert a Foley catheter as well as how to remove it and the documentation that comes with that. So the first thing that we're going to do is we're going to review the physician's order. I have here nursing Jake. Date of birth is January 1st, 1960. It is now February the 7th, 2021 at 7:36 in the morning, and the physician has just given the order to insert Foley catheter now to monitor the fluid balance, the intake and output more closely, and they have signed off on this order, so that is what I'm going to do now. I'm going to perform hand hygiene and gather all my supplies. So these are my supplies. I have my drainage bag, my Foley catheter, my catheter kit, and my sterile gloves. Okay, so just gonna do my hand hygiene again. So I actually did do the peri-care for this patient already. It's already done prior, so we don't need to do any of the peri-care now. So we're gonna enter the room, and upon entering the room, we're gonna do a safety check. We're gonna hand hygiene. Hi there, my name is April, and today I am your student nurse. Can you please state your name and date of birth, please? And this patient will state their name and date of birth as Jake Nursing, and their birthday as January 1st, 1960. I'm also going to compare that to their armband. So I have here Nursing Jake, which is the same thing as Jake Nursing, and their date of birth is January 1st, 1960. So that's good. Okay, Jake, so I'm just going to be inserting a Foley catheter in you today. It is a sterile tube that will just go up, starting from your urethral meatus. It will go up to your bladder and held there in place by a balloon that has been inflated with sterile water. The catheter will just drain all of the urine from you, so you don't actually have to go to the washroom anymore, and then it will drain it into a bag. We're giving you a catheter today to monitor your input and output a lot more closely. Because of the nature of the catheter, please don't tug on the tubing or do anything that would cause tugging and pulling on the tubing, because it can be very uncomfortable, and it may cause trauma to like your insides. So please don't do any of that. Do you consent to this procedure? Yes? Okay, so my patient does consent to this procedure. I'm just going to help my patient into a supine position with the legs slightly abducted. And I'm going to also place a waterproof pad below my patient. So now that my patient has consented to the procedure, I can go ahead and start doing my Foley. So I'm just going to start with my drainage bag. So usually I would put this drainage bag into a non-movable part of the bed, but in this case, I don't have a bed, so I'm just going to put it in this chair and secure it with this tape. Okay, all right, and I will be taking my Foley catheter kit. This is a sterile procedure, so I'm going to be very careful to only touch the 1-inch borders and remain sterility. So I'm just opening my kit. And that's garbage. Finding the 1-inch border. Oh, I have opened it the wrong way. That's okay. Just like so. I haven't contaminated the sterile field. I've just manipulated it. I've only touched the 1-inch border. Okay, so here, and lifting this up, I will acquire my forceps now, and okay, putting it square. I'm handing myself the garbage bag. Okay, it's still okay. And the tip of the forceps is still sterile, so even if the lower end is not, just placing my garbage bag here. That drape will be just an extension of my sterile field. And just gonna straighten the drape. Okay. Alright. Now I will have my catheter. I will open my catheter. To expose the blue catheter, I'm gonna banana peel it using my forceps. Just grabbing my catheter. It's quite difficult to grab actually, so. I'm dropping that onto my bolt. Perfect. I'm just gonna drop that into there and putting this here. Okay. Hand hygiene because I scratched my nose. At this point, I'd like to don on my sterile gloves. So just being very careful. Accidentally touch the 1-inch border. Okay, touching only the cuff. Inserting the first glove. Okay, and the other one. Okay, that's fine. I'm just gonna fix my gloves because my hands cannot touch because it's sterile to sterile. So I'm just fixing that up. I'm not touching my cuffs though. Okay, so from this point on, I'm just gonna grab my catheter and I'm gonna open it. And this I'm going to drop. Inspecting my catheter and making sure everything is intact. It is okay, so I can put that right back down there onto my boat. Inserting the hub to the end of my catheter. And with this lubricant jelly, what's my time right now, Teach?
8.5.
8.5. That's okay. Garbage. And just gonna loop up this catheter 6 to 8 inches. So that's how far I'm going to be inserting. Okay, so my catheter is adequately lubed, and I can just take it to the patient's bedside. Okay, so from this point on, I'm just going to retract the, stabilize the penis and retract the foreskin. I'm just gonna clean the urethral meatus and all the way to the glands in a circular motion. I'm gonna do this 3 times. Okay. All right. Now, with a gloved hand, the sterile gloved hand, I can hold the catheter. Jake, if I can just get you to bear down, and as I will be inserting the catheter now. if you can just bear down for me and take a few deep breaths. Okay, so I'm inserting the catheter about 6 to 8 inches, or until I start to see urine. I'm seeing urine now, so I'm going to advance it an inch to 2 inches more, just to ensure that I am right at the urethral meatus. And with my non-dominant hand, I'm going to stabilize the catheter as I insert the sterile water into it. So I have 10 milliliters of sterile water going into the catheter now. I'm just gonna do it very slowly. How are you doing, Jake? Okay, and keeping that pressure on. I'm going to just keep it there and take my syringe off. So, okay. All right, so the urine is still flowing. I'm just going to gently retract the catheter to feel the resistance, to ensure that the balloon has been inflated. I do feel a slight resistance, so it can stay there. All right, so now my hands are no longer sterile. So I'm just gonna take my drainage bag, and everything underneath this blue cap is sterile, so I'm gonna take note of that. So I'm just going to insert my catheter to my drainage bag, like so, and secure this to my patient's leg, like I have already done. Okay, and I will now do, so I have attached this to the patient's leg. I will take off my gloves, so wash my hands. I will do peri-care on my patient. So washing my hands, doing peri-care on my patient, and cleaning up around the bedside, and ensuring that my patient is in a safe, comfortable position. I do an exit safety check. I do an exit safety check. So peri-care, it's been attached here, and cleaning up around the bedside, and then so ensuring that my patient's in a comfortable, safe position. I am doing a quick exit safety check and making sure that the call bell light is in reach, and I will be back to monitor the patient. So the documentation that is necessary at this part is I have inserted a 14 French Foley catheter with sterile technique. The consent was given. I only had to do one attempt, and I got it. The patient tolerated well. The insertion was very easy. I inserted 10 milliliters of sterile water into the balloon. I was able to obtain 200 milligrams of urine, amber yellow urine, during the procedure. The reason for the catheter is to monitor the patient's intake and output more closely. And then I will initiate an intake, an in and out record sheet, and so that's done with the inserting the Foley catheter. So at this point, I will be doing I will be demonstrating how to remove a Foley catheter. So just gathering my equipment here. Okay, so I'm just gonna review the doctor's note. What time am I at?
15.
15? Okay, the doctor's note. So I have here nursing Jake, date of birth January 1st, 1960. The doctor has given an order to take out the Foley catheters because they no longer want to monitor the input and outtake of this patient. So that's exactly what I'm going to do. I'm going to do hand hygiene. I'm going to collect my materials. So I'm going to collect my 10 milliliter syringe. I'm going to collect clean gloves. So these are clean gloves and an absorbent pad. I'm going to enter the room. I'm doing a safety check. Hi there, my name is April and I'm your student nurse. Can you please state your name and date of birth, please? The patient states their name and date of birth as Nursing Jake and their date of birth as January 1st, 1960. So, okay, and I'm also checking their armband, seeing that it's Nursing Jake and their date of birth is January 1st, 1960. So that's good. Okay, Jake, I'm just here to remove your Foley catheter. The doctor doesn't need to monitor your input and outtake anymore. Do you consent to that procedure? My patient consents to the procedure, so that is good. I'm just doing hand hygiene and I'm putting on clean gloves. Okay, I'm just checking the drainage bag and I'm emptying it and recording how much is in the drainage bag. So I see 300 milliliters of very clear yellow urine with no particular odor. So I'm just gonna drain that. I'm also gonna take off my gloves, wash my hands and put on new gloves. I'm also gonna take off the tape that is securing this catheter to my patient's leg. I'm taking my hub. I'm just gonna insert it into my Foley catheter and hold on. So before I take my hub and insert it into the Foley catheter, I held my patient into a supine position with their legs abducted and an absorbent pad underneath them. And then so now I can take my hub and insert it into my Foley catheter and slowly take out all of the solution from the balloon. Okay, and now that everything has been taken out, I can slowly retract everything from the catheter from this man's penis, and then I'm inspecting the tip. It is still intact and there is no blood. So everything from this point on can just go in the garbage. Same thing with the absorbent pad as well. I'm just taking everything to the garbage. I am going to do pericare onto my patient and I'm going to take off my gloves. I'm going to wash my hands. I'm going to put them in a nice comfortable position and get in a safe, comfortable position. I'm going to do give them the call bell light, exit safety check, and the kind of documentation that I require for removing a Foley catheter is saying that I removed a 14 French Foley catheter because the doctor no longer needed to monitor this patient's input and output. The removal was tolerated well by the patient. It was very easy. I noticed 300 milliliters of urine on the drainage bag, a very clear amber urine on the drainage bag. This patient is due to void in 8 hours. I was able to take out 10 milliliters of sterile water from the balloon, from the catheter. The catheter tip was intact and there was no blood. And I will monitor and maintain the input and output record for this patient. And that's it. Thank you.